From Washington, D.C. to your computer, this is SoundBytes with Sam Farr, a timely look at issues of the day. And now, Congressman Sam Farr.
Hello and welcome, viewers, to our new online video show with Congressman Farr. This is called SoundBytes with Sam Farr. This is going to be a regular, hopefully weekly update of issues important to the Central Coast from here in Washington. Congressman Farr, thank you so much for taking time out of your day to talk with us today.
No, this is terrific. I really want to be able to try to communicate in the media which is used now, and these ideas of doing SoundBytes and doing kind of constant feeds is, I think, very important to keep people well informed of the busy activity here in Washington.
Great. The issue that we're going to cover today is healthcare. Healthcare reform is a top priority in Washington right now. Just last week, the House introduced H.R. 3200, America's Affordable Health Choices Act. Congressman, can you tell us a little bit about this legislation?
Well, this legislation is really needed in this country because we've been talking about healthcare reform for decades. The problem is we've never been able to focus on getting it done. We all know it's broken. We've seen premiums double in the last 7 or 8 years. That means if we do another 7 or 8 years, premiums will double again. And if you carry that out, you see that what's going to happen is that the biggest cost in your life is going to be your healthcare costs. And if it's the biggest cost for the individual, it's also the biggest cost for government, because government insures all the people in Medicare, insures all the people that are federal employees. State do it for the state employees, and counties and cities and school districts for their employees. So the taxpayer money that is being committed to health care will take it from somewhere else. You'll have less for education, less for roads, less for other things that the government needs to do. So it is so broken that to do nothing is not an option.
One of the criticisms that have been expressed about this bill is that it is nothing more than socialized medicine, some of the scare words that critics use, that this is going to force government health care on people. What's the response to that? Is that true?
Well, I think it's just a scare tactic. I mean, the president said from the outgo that if you like what you have, you can keep it. This bill is about choices. And if you don't like what you have, you'll be able to look around to see what other choices you'll have. You can't do that now. And it's actually opening up choices for people rather than socialized medicine. That's just, I mean, people talk about socialized medicine and then they love Medicare. Medicare is essentially socialized medicine, and it works. But that's not, the Medicare program isn't going to be the only program out there that people can choose for health care. And in Medicare, you still get to choose your doctor. Now, the doctor has to receive the Medicare reimbursements. But and we've had some problems with that in our area, but we're in this big health care reform bill. We're also fixing the reimbursement problem for the Central Coast. The Santa Cruz, Monterey, and San Benito counties doctors will get the same kind of reimbursement that doctors in Los Angeles and San Francisco get.
There are some issues that have historically troubled healthcare reform, such as portability of healthcare. If you're changing jobs, you might lose your healthcare. Another issue is pre-existing conditions. How does this bill address issues like those?
Well, those are a good question, and I think the keen thing in here that people really haven't focused on is that insurance companies will no longer be able to deny you insurance because of a pre-existing condition. What's a pre-existing condition? Say you have cancer. And you go in and you want insurance, and they'll say, well, we'll insure you for everything but cancer. Or we'll insure you for everything but the disease you have or your family has had. And or we'll sell you insurance at a much higher cost. Insurance companies are going to have to be in the business of insuring all people. If you want to choose that insurance company, then they have to give you insurance. So we will not allow the insurance companies to cherry pick or deny people because of pre-existing conditions.
What kind of a timetable is this bill on in the House?
Well, timetable is important in Washington because tough decisions are always put off. They're put off in our personal lives if they're tough, and they're put off in our political lives. And so the president was right in deciding that we had to do it this year. The internal mechanisms of when the bill goes out of committee, the 3 committees in each house, in the Senate, and 3 committees in the House that have to rule, to have jurisdiction, that have to pass their versions. That's happening. 2 of the 3 have so far passed it. The Commerce Committee is at the White House today talking with the president, and they should have their bill done by the end of this week. And so next week is the last week of July, the week before we recess for our summer vacation with our family. So, and our work period's back in the district. So it is, the deadline here is to try to get the House and the Senate to get their internal business done before we adjourn, leaving the month of August for the two versions to be well known by the public, and giving that month of absorption to be able to come back and deal with a compromise between the House and the Senate, which would go to the President by the end of the year for him to sign. So hopefully we get it done this year.
Great. Thank you, Congressman Farr, for your time, and we look forward to doing this again soon.
Thank you. It was great.